certain particular diagnoses or vascular problems that are just best treated in an office setting. So we would make that determination after we evaluate the patient, see what their particular issues and needs are. On the arterial side, we primarily are treating blockages in the legs. That's the most common type of office-based procedure that we would do in arteries. And those are patients, smokers, often diabetic, and they present with issues of pain with walking or sometimes wounds on their feet that they can't heal. And we have various means of dealing with that and opening up those blockages that we can do right here at PCI. We weren't able to start to do those procedures really until the pavilion was built, because we didn't have a location that would even make that possible. And part of the construction design and build out of the Medical Pavilion 1 to allow for the development of an outpatient vascular procedure room. And we were able to do that in Medical Pavilion 1, and then since moving to Medical Pavilion 2, we kind of had a trial run, as it was, and we were able to take the things we liked about the first room and then correct the things that we thought could be better. And so now we really have an excellent, very efficient and useful space here in Medical Pavilion 2. What a procedure is like for a patient, they'll come in to the pavilion. We have them check in at our office, and the office-based vascular lab is connected directly to our clinic as well. So one of our staff will take them back. They do have an IV put in so that we can give them some fluid, and if we need to give them any intravenous drugs during the procedure, we can do that. We usually have them take just some oral Valium, like you might take if you've had LASIK surgery or some other office-based procedures. It's a gentle anxiety-reducing medication many people take, and it kind of takes the edge off. And in fact, most of the time, people will drift off to sleep if you aren't bothering them too much during the procedure. When we bring them back into the room, we'll put on some drapes. Like it looks kind of like an operating room, but not nearly as involved. And then we set about trying to solve the problem. For example, someone who would be complaining of the inability to walk more than a block because one of their legs just starts to ache and throb and they have to stop walking and wait for that to go away. Well, many times that's because of a blocked artery in the thigh. So we'll access the vascular system, usually in the opposite leg. I use ultrasound, a little bit of numbing medicine, and we can pass a needle and a wire and then a catheter through that artery. And using X-ray, we can direct that wire and catheter down into the opposite leg. We can cross that blocked artery, and then there are various modalities to then open it up. Yes, balloons can be used. We do a great deal of what's called atherectomy, particularly directional atherectomy. It's a plaque removal device, and because it's directional, you can be very precise about where the plaque is that needs to be removed, and we create a larger opening in the artery. We will then often use balloons that have a particular anti-restenotic drug mounted on it. So you blow the balloon up, and this medicine goes into the artery, and that reduces your rate of recurrence. And then finally, if we need to, we can place stents as well, although I prefer not to put stents in. Generally, the long-term success rates are better if you don't need to have a stent. Afterwards, we'll finish things up and take the patient to the recovery area. And they need to be on their, flat on their back just to make sure they don't have any bleeding issues or things for about an hour. And typically, people are home within 2 hours after the procedure. It's so much easier for the patients and their families to come to PCI, walk right in. There's no elaborate check-in process. It's very convenient, efficient, quick. And I find that not being in a hospital, it tends to be a little more relaxing. I think people are less apprehensive about their procedures, and it's normal to be, of course, a little nervous about anything. I will joke with patients that if you can handle going to a dentist's office, you won't have any problem here. And of course, people do get nervous about the dentist as well. But it really is a much easier environment to function in that way. Because we're very efficient here, we don't have the same layers of overhead and whatnot. It's much more inexpensive to have similar procedures done in an office-based setting versus in a hospital, and that's not just for the patient. In many cases, they only have an office copayment, whereas they would have a very different insurance structure in a hospital setting. But I think just as importantly, it saves a lot of money for the healthcare system. So it really benefits everybody. It seems pretty clear to me that the future for the treatment of many of these problems truly does lie in the office setting. It's proved to be safe, and that's not just in our experience, but the longer that surgeons are doing these types of procedures, the literature also supports that these are safe and appropriate. From an economic standpoint, it's much better for the healthcare system when we move things to a less expensive environment. Just as important, the patient satisfaction that we see is really through the roof. They're very happy, especially the patients who've gone through a hospital-based procedure compared to here. We really get a lot of positive feedback from them because of the ease of things, and sometimes they're nervous, and almost universally afterwards, they come out and they say, yeah, that really wasn't that big a deal.